Before you start hip hinging, you're going to take your hips forward a couple of times, forward and back until your leg is vertical, to just get a sense of that range of motion. Take the top of your legs back until your pelvis tilts forward a couple of times with a motion around the hip joint. Your sacrum and tailbone are going to reach behind you and up towards the back wall and the ceiling, and you are just going to repeat this a couple of times until you get a sense of the motion, avoiding bending your spine. One way to make sure that you are bending from the hip joint and not the spine is to take a stick, put it on your sacrum and upper back, and hip hinge without changing the shape of the spine during this motion. Another way to avoid bending the spine is to monitor the distance between your front ribs and the front of the pelvis, and keeping this distance unchanged during the motion of the hip hinge. So you have to avoid bending the spine, but also extending the spine and thrusting the ribs up. In order to get a better sense of the motion, especially at the back of the legs, you have to press your heels strongly onto the floor as you take your legs behind you and tilt your pelvis forward, and then keep pressing your heels onto the ground as you come up. Sometimes it helps to rest your hands and arms onto something in front of you, whether it's a wall, a chair, or another piece of furniture with an appropriate height. Something else you can do in order to make sure that you do not bend your lower back is to pinch some skin around the spine at the lower back, and then as you bend down, you don't want to feel a pull between your fingers. Something else you need to avoid is actually bending excessively at the upper back. So as you start hip hinging, it's good to have the position of the ribs and pelvis fixed as a relation to each other and not allow the ribs to move. Feet should be pointing straight forward, upper legs are externally rotated, and the kneecaps are relaxed.